Hello everyone. Today I'll be continuing with this lecture regarding the welfare services. I had spoken about in my previous lecture. I had spoken about that what are the historical background of welfare services, uh, the various types of welfare services and the service welfare services delivery mechanism. Today I will be discussing about funding and budgeting for welfare services. What are the challenges, how you need to evaluate welfare services, and then there are certain innovations and future trends. Now if I talk about the funding and budgeting for welfare services, funding and budgeting for welfare services in India are complex, but as they cover a wide range of social programs which have been designed to address poverty, healthcare, educational, rural development, and more rural and urban development, if I would say so. So, India's welfare budget is derived primarily from tax revenues, public borrowing, and contributions from both central as well as the state government. The country receives financial support from international organizations also, particularly for projects in healthcare, education, and poverty reduction. Now, there are various, way of understanding or how these budgeting and funding has been done. If I talk about central and state government funding, the central government plays a very significant role in the welfare in welfare funding through its annual union budget. Welfare programs are primarily financed through budget allocation in sectors such as healthcare, education, rural development, social security, social assistance, food security, and then major ministries, the ministries which are there in the governance, they are responsible for the welfare services, which would be like the Ministry of Health and Family Welfare, Ministry of Education, Ministry of Rural Development, Ministry of Women and Child Development, Ministry of Social Justice and Empowerment. So the various ministries have been allocated along with the kind of welfare schemes or programs has to be initiated. The separate ministries given based on the target population, based on the beneficiaries, the number of beneficiaries in for achieving that welfare services. So budget is allocated, and the ministries are responsible for the welfare services, which would allocate the budget and funding for that particular scheme. Then welfare programs in India are often implemented by the state government, which also contributes a major portion of the funds. States may allocate the states may allocate state government contribution. Welfare programs in India, they're often implemented by the state government, and the state has a significant contribution in the matter of funds and budgeting. State allocate funds based on their specific welfare priorities, which can be varying and depending upon the regional needs, the social needs, and their health needs, that what are the most pressing needs of that particular state. Then there's many centrally sponsored schemes. Many welfare services in India are also being administered, or they are also being taken care by the centrally sponsored scheme, where the central government provides the majority of the funds, and the states government have a little contribution. The rest of the monetary benefits are being provided by the state. So the larger portion of the budget allocation is done by the center, and the few it is done by the state. Like Manrega, if I say that Manrega is one of Pradhan Mantri Awas Yojana and National Health Mission, these where the contribution is a centrally sponsored scheme and they have more contribution of the center. Then there are certain sources of welfare funding like tax revenues. Welfare services are usually funded primarily through tax revenues, which include direct taxes, income direct and indirect, like direct taxes, the income tax, and indirect tax like GST and state tax. So tax revenues are crucial for sustaining welfare budgets, especially in the social sector funding, social sector spending. Then you have a social sector cess. India imposes specific cesses like the corporate tax, the health tax, education cess on income tax. And corporate tax, which are earmarked specifically for welfare spending in the health and education sector. Then there's a borrowing and deficit financing to fund welfare programs and other developmental expend and other development uh, expenditures, to fund borrowing, to fund welfare programs, other development expenditures. The government often relies on borrowing and deficit financing, especially when tax revenue falls short. So there is a reliance on borrowing increases the fiscal deficit, necessitating careful balancing. And there are various, if you look into this was one part, but then the types of the schemes, the welfare schemes and the budgets also enhances the, or also talks about the role of budgeting and financing. Like what kind of social and security and employment programs are being created. If I say that programs like Manrega, they receive substantial budget allocation which would provide employment to rural households. So there was a huge amount of money. If I say that 60,000 crore money was allocated to Manrega program. So this is vital for income security and poverty alleviation. So depending upon the the significance, the importance of the welfare scheme, and in which sector it has been implemented, in which state the allocation is done. Like health and nutrition, if you talk about health and nutrition, Ayushman Bharat, the world's largest government funded health assurance schemes, which provides health coverage to low income families, in addition to National Health Mission and other healthcare initiatives, are funded through both central as well as the state budgets. Then there are education, food security, housing and urban development. So these welfare measures, when you talk about the types, or when we talk about the sources of welfare funding, these are the various means and modules. Then the role of private and public partnership, I had mentioned earlier, there is a collaborative funding model. In India especially, India have adopted a public private partnerships for welfare projects, particularly in infrastructure development, skill development, healthcare. Then we have corporate social responsibility. CSR activities have been undertaken by the Companies Act 2019, which incorporates companies, or which made the companies, corporations, organization mandatory to spend a percentage of their profit on social welfare and activities in education and health and rural development. Then there is international funding and aid, multilateral and bilateral aid, financial assistance, technical assistance from international organizations such as World Bank, International Monetary Fund, Asian Development Bank, United Nations agencies. These funds are directed towards the welfare projects in various sectors, be it health, education, poverty reduction, etc., and so on. Then there's foreign aid specific programs. Foreign aid and grants are often used for targeting welfare projects, where UNDP or UNICEF, they contribute largely to education and nutrition program which may be running in India. Then budgeting and allocation process. When you talk about the budgeting and allocation process, it is done through union budget. The Ministry of Finance presents a union budget every year which allocate funds to various ministries and welfare programs, especially to those ministries who are looking into the welfare aspect. So budget allocations are based on the socio-economic priorities, political considerations, as well as feedback from the stakeholders. Then there are state budgets. We all know that each state government prepares its budget with allocation toward welfare means and measures relevant to local needs, and the states have the flexibility to prioritize the areas such as health, housing, agriculture, regional requirements and infrastructure development. Then Niti Aayog and planning. Niti Aayog, the government's policy think tank, it plays a very significant role in formulating welfare strategies and recommending budget allocations for the key welfare areas, especially in the infrastructure, health and education. Then there is a monitoring and accountability of in welfare spending, audits which has been done by the Comptroller and Auditor General, CAG, the CAG of India, audit government spending, including welfare expenditure, to ensure transparency, accountability, and efficient use of the public funds. Then there are certain performance monitoring by ministries. Ministries responsible for welfare programs are monitors the spending through the various performance metrics, which are often publishing reports to to track the effectiveness of welfare initiatives and tries to identify the areas for improvement or to look into any loopholes or any practices, any corrupt practices which might have hampered the growth of the program. Then beneficiary feedback and grievance redressal to ensure that the funds are used effectively. Welfare programs often include grievance redressal mechanisms and the feedback system, helping authorities improve service delivery as well as reduce leakages. Then there are certain challenges in welfare funding and budgeting. There would be fiscal constraints. India's welfare budget is often limited by the need to manage any fiscal deficit and allocate resources to other areas like defense, infrastructure, and debt servicing. So, balancing welfare spending with fiscal stability still remains a challenge. Then, sometimes leakages in welfare spending, often due to corruption and inefficiency and carelessness on the part of the authorities, can also reduce the impact of the welfare programs. So, the government is increasingly relying on technology such as direct benefit transfer DBT to reduce any leakages and improve transparency. Then dependence on borrowing, with significant portions of welfare funding coming from the government funding, sustainability is a major concern. It is a constant balancing act for many of the policy makers. So then there is a high demand for welfare services in areas like healthcare, education, employment support, which results in it sometimes outstrips available resources, leading to underfunding and rationing of services. Then innovative funding mechanisms, there are a lot of innovative funding mechanisms through which the delivery systems can be given to the, delivery system can be made more effective. Like there is a direct benefit impact, there is a social impact bonds. A direct benefit transfer is to transfer subsidies directly to the beneficiary bank accounts, reducing middlemen, corruption and leakage. Then there is social impact bonds. There has been interest in social impact bonds as a way to fund welfare projects. Private investors fund specific social programs and the government repays them based on the outcome which achieved. This model promotes accountability and innovation. Then their digital payment systems are increasingly used to distribute welfare funds, especially in rural areas, which would ensure payment reach beneficiaries directly and securely. So India's approach to, if you like to talk about the concluding remarks of this particular funding and budgeting welfare services, it is a blend of centralized planning, state level implementation, and collaboration with private as well as international partners. The government constantly seek to balance welfare spending with fiscal responsibility while ensuring equitable access and efficient delivery mechanism. Innovative mechanisms like DBT, PPPs, and CSR contributions, along with the strategic use of technology, have strengthened welfare funding in recent years. However, there are certain challenges like limited budget, leakage, and regional disparities continues to require attention, and ongoing reform aims to create a more effective and inclusive welfare system in India. If you talk about the evaluation of welfare services, it is very important that these welfare services are being constantly evaluated, constantly monitored to ensure that the programs are effectively address social issues, promote equity, and efficiently use public resources. Evaluation allows government and policymakers to assess the impact, efficiency, and sustainability of welfare programs, and it also identify key areas for improvement. Now, if I talk about how evaluation is done, first you have to set up these evaluation objectives. Evaluation objectives has to be set according to the impact assessment. So impact assessment has to be done whether to gauge, to understand whether these welfare services have achieved their intended outcome, such as if it aims at reducing poverty, then is it or improving healthcare services. So is it actually, so the objectives of evaluation has to be very very clear cut. There has to be no ambiguity. They should be specific, they should be precise, and they should be directly to the goal or to the broader aim of the welfare. It should direct towards the broader goal of the program. So this helps in determining the program has met its goal or not. Programs are evaluated to see if the resources are being effectively used, efficiently used, comparing cost with the benefits provided. So, the cost benefit analysis, effective analysis has to be done in order to identify whether the same impact has been achieved within fewer resources or not. Then evaluations examine whether, if you talk about equity and accessibility, evaluation evaluation examine whether welfare services are equally distributed to a larger population, and they have accessibility to all eligible populations, including the marginalized or underserved. Then there is an issue of sustainability and long-term impact. It's very important to evaluate these welfare services, whether to understand whether they are sustainable or not, or whether they are producing the desired goal or the lasting benefit, such as breaking the cycle of poverty or supporting lifelong health insurance and education improvements. There are certain key evaluation metrics, like first of all, we need to understand the coverage and reach. Metrics has to be initiated on how many eligible individuals or communities are actually receiving the welfare services. High coverage indicates that the program is accessible and it's reaching its target population. Effectiveness and impact can be measured in terms of the success in meeting specific objectives such as reducing poverty, increasing literacy rates, or improving health condition, accessibility to educational institutions. Then there is effectiveness and cost efficiency. It tries to compare and compares the financial and administrative cost of the program against the benefits it deliver. So an efficient program maximizes impact with minimizing cost. And then equity and inclusion. When we talk about the evaluating welfare services, it is very important to see whether the welfare services are actually accessible to all eligible groups, especially those who are marginalized, without any discrimination or system barriers. So there is an element of inclusivity as well as equity when we are talking about the delivery of these welfare services. And then there is beneficiary satisfaction and feedback. Measure satisfaction levels among beneficiaries has to be taken up to gauge if these services which have been rendered to the people are it had actually met their objective and their needs. So this feedback becomes an essential part in improving the service quality as well as relevance. Then there are various types of evaluation: formative evaluation, process evaluation, outcome evaluation, as well as impact evaluation. Now, if you talk about the formative evaluation, it is conducted during the development or early implementation of the program. As the name suggests itself, formative evaluation, when the moment it provides feedback which would help the program improve, which help the improve program design and implementation. So at the very formal stage of the evaluation, when the program has been implemented, has been designed, so it tends to look into the early implementation of the program. Then process evaluation, this type of evaluation, it tries to focuses on how a program is implemented. It examines the delivery mechanism, its adherence or conformity to guidelines and principles, and also it tries to gauge the effectiveness of program administration, how the program has been administered, how efficiently and effectively it has implemented. It's whether it's useful and for identifying any bottlenecks and inefficiencies. So through process evaluation, you also tend to identify any kind of inefficiencies or bottlenecks in the implementation of the welfare services. Then the outcome of evaluation. In outcome evaluation assesses the direct effects of the program on its beneficiaries. When you talk about the outcome, the name itself suggests what has been been the impact, what has been, whether if we look into the outcome, whether it has achieved desired objectives or not, because there had been goals and objectives which has been identified. So whether they have reached the goals, whether it has what kind of direct effect or impact it has on the beneficiaries. So that is the outcome evaluation. And then impact evaluation, it measures the broader long-term effects of a program on social and economic conditions, and it often requires to control groups or comparative data to attribute outcomes which would be directly related to the program. Then there are certain evaluation methods like surveys and questionnaires, interviews and focus group discussions, case studies, data analysis, analytics and administrative data randomized control trials. Now, if you look into the surveys and questionnaires, of course, surveys are widely used to collect quantitative data on program effectiveness, beneficiary satisfaction and accessibility. Like household service can provide data on income levels, health access as well as education attainment among beneficiaries. Interviews and focus group discussion forms the basis for a more qualitative approach, where in-depth interviews are taken and focus group discussions are done with the beneficiaries, with the program staff as well as the community leaders, which would help in gathering qualitative insights on how the program operates, how it strengthens, the program operates, in what manner it is impacting the lives of the people, its strength and weaknesses, and what is the scope for the improvement. Then through case studies, they also allow evaluators to take an in-depth look at the specific communities or groups within a program, which would provide detailed insights that may emerge from the quantitative data. Then data analytics and administrative data, analyzing administrative records, such as enrollment, attendance and spending data. It offers insight into programs usage and operational efficiency. Data analytics can identify patterns, trends and the areas of improvement. And lastly, there is randomized control trials, that is data randomized control trials or RCTs, which are sometimes used in welfare evaluation to isolate the effects of a program, comparing outcomes among a treatment group who received the program and a control group who did not. So RCTs provides a robust evidence of a program impact, but can be a little more costly and complex to implement. Then there are certain challenges in evaluating the welfare services like data quality and availability. In many cases, the data required for thorough evaluation may be unavailable. Sometimes they are outdated or maybe unreliable. So ensuring data accuracy and timelines is essential for effective evaluation. And then there are resource constraints. Resource constraints are also there because evaluation requires funding and trained personnel and time, which may be a limitation, especially in the low income settings or for small welfare programs. Then attribution of outcomes, measuring the direct impact of a welfare program can be very challenging, and because outcomes may be influenced by external factors such as economic conditions, policy changes, political structure, social economic factors. And then in fact RCTs and longitudinal studies can help but are very resource intensive. Then political and organizational resistance, sometimes evaluation that reveal program shortcomings can face resistance from program administrators or political stakeholders who may be reluctant to accept criticism or make necessary changes. Thus, evaluating welfare services is crucial to understanding the effectiveness and ensuring that they meet the desired outcomes or intended societal objectives. By setting clear evaluation objectives, using a mix of qualitative as well as quantitative methods, leverage technology and overcoming challenges in data and resources, the policymakers can gain valuable insight into welfare program performance. And the process promotes accountability, it enables continuous improvement, and helps create a welfare system that is more responsive, equitable, and sustainable. Now, there is in terms of the delivery service, that welfare service delivery mechanism, I would like to little bit talk about accountability and transparency. It is very important that there has to be a certain amount of accountability and transparency, like sharing evaluation results with the public promotes transparencies and accountability. It also helps trust in welfare programs and ensures that the funds are being used effectively. Then independent audits should be also conducted by the agencies, like the controller and auditor general, which would have an unbiased assessments of welfare spending as well as program implementation. Then beneficiary and community feedback, this is a very important in aspect. If we tend to incorporate feedback mechanisms, it would allow beneficiaries to express their satisfaction, report challenges, or suggest any improvements. In fact, this engagement can help ensure welfare services are meeting the real needs of the population. Then iterative adjustment based on evaluation findings, welfare programs can be modified and refined to address identified challenges, issues, which would improve effectiveness and also maximize the impact. Then evaluation insights can drive broader policy reforms, enabling a more effective allocation of resources, improve targeting, and enhance program designs. And lastly, continuous monitoring. Establishing continuous monitoring mechanisms such as dashboards or periodic reports ensures that the welfare services remain responsive to evolving needs and challenges, allowing for the real-time improvements. Now, there are certain innovation in welfare services. When we talk about innovation in welfare services, it is about transforming how governments and organizations should deliver, design, and evaluate social programs to address evolving needs. From digitalization to personalized service delivery, these innovations aim to improve accessibility, efficiency, transparencies, and responsiveness, ensuring that welfare services reach the people who need them. And these are the service various programs. Like if I talk about the digital platforms and e-governance, there is uh, there is under digital platform and e-governance, there is direct benefit tax, there is single digital portal. They are many countries are adopting this single window portal, which would integrate various welfare services into one platform. Then there is mobile welfare applications, which allows mobile apps allow beneficiaries to have into access information, apply for benefits, tag their application, and receive any updates. Then again is biometric and digital identity system. India's Aadhaar system, a biometric ID system, is used to authenticate the beneficiaries to welfare programs, ensuring that the benefits are reaching the correct individuals. In fact, it has streamlined processes, reduced duplication, and minimized fraud. Then there is a digital ID program globally. Then artificial intelligence and data analytics also have become the norm of the day, and it can predict, AI and data analytics can predict which populations are most likely to benefit from specific welfare services, and enabling better, targeting and resource allocation. Then fraud detection and prevention, AI powered system analyzed transaction patterns and flag suspicious activities, reducing fraud and leakage in the welfare program. Then there is a personalized welfare recommendation, then blockchains for transparencies and security. When you talk about personalized welfare recommendations, AI today can also provide customized recommendations for beneficiaries based on their profiles, suggesting suitable employment opportunities and training programs. So these are the certain innovative measures which can be taken in the welfare services, like blockchain for transparency and security, then identify identity verification and data sharing. And there is a conditional cash transfer in incentive programs. Conditional cash transfer provides financial support to beneficiaries when they meet specific conditions, such as regular school attendance or for children or health checkups. Then there is a performance based incentive program. Welfare programs are increasingly offering performance based incentives, where beneficiaries receive extra benefits for completing the training. Then there are social impact bonds and pay for success. There is a public private partnership for welfare. The social impact bonds allow private investors to fund welfare programs with repayment from the government contingent on program success. Then out-based funding, which the SIBs and the pay for success model emphasizes outcome based funding. Then you have Internet of Things. There's IoT or welfare services. IoT devices such as wearable health monitors can track vital signs and provide real-time data to healthcare providers, which is valuable for remote and elderly population. Then there are smart cards for subsidized service. There are there are other aspects of innovations in welfare services, like geographic information system for targeted and planning, mapping welfare needs. GIS tools would help in identifying, in mapping the welfare planners, in helping or allowing the welfare planners to analyze geographic data and identity regions with the highest need for services. This data driven approach ensures that resources are allocated effectively. Then disaster response and relief. Then you have telemedicine and mobile health clinics, expanding accessibility to healthcare services. And training, telemedicine and mobile health clinics are there. Telemedicine allows beneficiaries, especially in rural areas or remote areas, to consult healthcare providers remotely, reducing travel time and improving health conditions. Then gamification for engagement and behavior change. The welfare program use gamification techniques to promote positive behavior, such as attending school, completing job training, or undergoing health screening. So these are there. Then educational programs are also gamified. Modules are used in education and skill development program. Then community driven and decentralized service models, where involving communities in designing and implementing welfare services and improve program relevance and effectiveness. Then there's a decentralized welfare delivery. Local governments and community organizations can implement welfare programs with flexibility to adapt services to specific regions' needs, as can be seen in decentralized model. Then there's a feedback loop and real-time monitoring system. Real-time feedback tools like the SMS surveys or mobile apps feedback forms allows beneficiaries to share the experiences, to report issues, make any suggestions, enabling the welfare agencies to improve service quickly. Monitoring dashboards is also there, which would track the real-time data on welfare monitor. Then universal basic income experiments can be done, which would provide a set income to all citizens regardless of employment status, to ensure a basic standard of living. Then impact on employment and well-being. UBI experiments are analyzed for their effects on employment, mental well-being and poverty levels. And then lastly, integration of mental health services in welfare programs. A holistic approach has to be taken up, recognizing the link between mental health and poverty. Some welfare programs would be integrating mental health supports, providing counseling services and peer support. Then there is digital mental health platforms needs to be created, which would be mobile based mental health services such as chatbots and teletherapy, providing accessible and mental health resources. So these are the some innovations on the innovations in the welfare service delivery, and which would aims to make social support system more inclusive, efficient and responding to changing times. Then we have the future of welfare services, integrating digital platforms, the automation of service delivery. If you talk about digital transformation and e-welfare, then there is a personalized welfare service. There's a personalized welfare services which I've already discussed. Universal basic income and guaranteed income models are there. Then target inventions are there. Then you have sustainable community led and decentralized welfare models, localizing decision making, collaborative welfare delivery services, then sustainable and climate resilient welfare services, where climate adapted welfare programs should be initiated, green welfare initiatives should be taken. Then blockchain for transparency and security, transparent and immutable records and self-sovereign digital identities should be taken up. Then global welfare standards and social protection networks, which talks about international collaborations and portable social benefits to the larger population. Health and mental wellness integration, then social impact bonds and outcome based funding models, flexible and age fragile welfare system. When you talk about health and mental wellness integration, there is a holistic health services as well as preventive health and wellness program. This through welfare system try to cater on, or look, it will try to focus on preventive care, promoting wellness through fitness programs, dietary guidance, and so on and so forth. And there are few more points, that is youth centric and future, flexible and age welfare system, youth centric and future ready welfare programs, gamification, AI tools, interconnected social and environmental policies. So the future of welfare policies is being shaped by innovation, inclusivity, and responsiveness to dynamic global challenge, and through digital transformation, personalized approaches, as well as sustainable practices, welfare system aim to become more resilient, adaptable, and aligned with the changing needs of population. The shift towards collaborative, technology driven, and outcome focused welfare services, which holds the potential to improve the quality of life for millions, ensuring that social safety nets are not only robust but also forward thinking and prepared for the challenges of tomorrow. That's all for my today's lecture, and thank you everyone. I'll In the next lecture I'll start with the new topic. Thank you.